If you see, I am currently present at the Unified Command Center in Chennai, and this is the one of the war rooms placed in Chennai. Before few days, M.K. Stalin, the Tamil Nadu Chief Minister, have also visited this COVID war room at night 11 o'clock and inspected a call which was demanding for. But you can see the pictures where there's a separate TV placed for here that from the morning they have been receiving the calls from the people. Total bed request calls have been received over 5,575, and the people who are demanding for oxygen have been received in the say 769 to 27. Sir,
War room, basically, what to say, when the second surge of infection started, like many states in the country, in Tamil Nadu also we started a unified command center. So later, which we designate as the war room. So this is basically to unify all the activities what is happening for the COVID mitigation and control, and to have a centralized mechanism so that we'll have a command over a lot of activities, because there are a lot of departments, directorates and line departments they're in the health department. So, and they're all mostly working with their own mechanisms and all, and they're all working very perfectly. But when in a war-like situation, when there is a huge surge of infection, we need to codify, we need to unify all the activities. We need an incident commander. We need to command a lot of things, and we need to get things done very quickly. So for that was a basic rationale why we started this COVID war room.
the clustering of ambulances at the hospital, sir. So we can zoom in and identify around which medical college the more number of ambulances are waiting, and we can immediately locate which ambulance and who is the driver, what is the reason it's waiting for. So we do triaging here also, sir. And regarding shortage of ambulance, it's not like that, sir. Every patient who require ambulance, they make a call to 108 and they are assigned with the ambulance immediately, sir. Also, along with this, the private places are also there. They are also taking.
Basically, is not taking all the calls or all the requests which is coming from the general public. So there is a existing 104 helpline. There is a social media handle for the 104. It's like 104_GOT and Twitter handle. And there are also WhatsApp channels. There's a public bed request forum is there. So from there, what we are taking is only those critical calls which request like immediate attention. Basically, for the O2 or the ICU requirement or for the O2 cylinders in the private hospital, we'll be diverting those calls through a protocol-based mechanism and through an IT-enabled software, which is also prepared in-house by our people based on the local context. So it will come to us. So there is an initial triaging happening at the existing 104 helpline. From there, all those requests which is bit critical will come to us. Again, then we have a lot of like 10 to 15 doctors at one shift, at 8 hours one shift, who is sitting and who will be triaging. Sometimes they'll be doing only the phone triaging. Sometimes will be the video triaging when the case is so critical. And based on the protocol-based triaging, then they'll send the request to the bed management team.
Beds have been noted over here, and I also show you the pictures where ICU beds, there's a separate allocation for ICU beds, O2 beds and non-O2 beds. I'll also show you the pictures where this is the place where ICU allocated beds given by the government. 9,324 is the allocated beds, and nearly 8,875 has been occupied, and nearly 450 has been vacant. And also show along the picture, there's O2 beds have been available, 40,000 O2 beds have been available, but only 37,000 have been available, occupied now. So the 2,650 is the vacant rate now. Along with the non-O2 beds is 83,551 and occupied is 45,669, and the vacant is 37,882.
1,000 odd calls which we'll get, among them only 50% are genuine requests. So that's the thing. So if you take don't...
So all the 50% who have been calling here are given beds, or they have also been waited outside the hospitals?
No, not all are. We won't be able to give beds to all the 50% who are calling to us. But our plan is like, since there is a district, from across the state we are getting the request. So there is a district war room which we created where the district collector is the incident commander. So we'll be communicating to them also.
The bed request will start from the general public. We have given access through 104 Health Helpline where they can directly call and tell their request. And we have given a open link to every public to generate their own reference ID. So we are not waiting for the call to connect. So public can use that link. They can directly key in all these details, and after entering the details, they will get a reference ID. The reference ID is the key thing for follow-up from all of the desk. So immediately after getting the calls, I think our doctors are calling back. I think most of the calls will be covered within an hour.
There's an existing 104 helpline is there, and then during this crisis, we started a social media surveillance also, which we have started a Twitter handle as well as a WhatsApp handle. Then there is also which is not here. There's a public media request where anyone can put the request. So from there, it will be coming to the triaging team. So which I told, which is the most pivotal structure in the whole COVID war room. From there, they'll be doing a tele-triaging or a video triaging. So mostly certain people who really require critical care, they'll be doing a video triaging. So from there, the triaging team will divide the cases, and when the patient clearly requires a bed requirement, it'll be sent to the bed management team. So the bed management team create an alert, and they'll then verify the real-time bed data and understand, okay, in this hospital, and will also verify the patient where the patient can travel and reach the hospital at the fast.
Getting you all this reports from Unified Command Center in Chennai, this is reporter Yash Raju for Republic Media Network.